Hur går det? Ja. Hello, 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 everybody. Welcome, 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 welcome. Hopefully you guys have had a good day. Well, we are live, everybody. Welcome. I think I see, let's see, who do we have out there? We got a few viewers. I see Francis. Hey, Francis, how are you? And Ashley and Ella. Welcome, guys. This has been an interesting day indeed. Hopefully you guys like the music. Once again, that's from Epidemic Sounds. Epidemic Sounds. It's going to be who's giving us music here over the next little bit. A new week. Started a new week. Very interesting weekend this weekend. We had some problems with some worms in our yard, and I spent a lot of time trying to take care of those. But I am here. It is in August, one more week after this. And can you guys believe that we are moving through the year? You know, last year, this time, we didn't know where we were going to be. But here we are, and we are doing well. So welcome to everybody who's out there. Ashley, Francis, Maria. Glad that you guys are here. So a question for you. Do you guys see Yoda back there? Is he clear? Yoda, we're trying to, his lightsaber fell down, and so we're trying to make him look good back there. I know he's a little blurry, but that's okay. We got it that way. All right. So today we are going to be talking about what everybody's talking about, but a little different spin, right? So COVID-19. And so the questions that we want you guys to pose are questions relating to COVID-19. And the little spin we're going to put on it is as it relates to diabetes, right? So now you can ask questions about COVID in general, but if you have specific questions about diabetes as it relates to COVID, we're going to be feeling those. And one thing that I want you to do, I'm going to pull a question up here really quick in a minute. But if you would, when you're asking a question, put the letter Q in front of the question so that I'll know that that's a question that we need to answer and not just a comment. So if you do that for me, that would be awesome. All right. So COVID-19. It's a little hot down here, so I'm, using my little. Can you guys see that? It says, "Great job, Dad. I turned out awesome." That's from my son. So that's what I'm drinking my beverage out of, some water. Okay. So COVID-19. So everybody is. I guess we had all taken a breath, I think. Right? Because we were here, COVID-19 had started, and everybody was back in homes, and we were socially distancing, and then we started trying to get out a little bit, and now we have variants, right? So Delta, we've got Lambda, and it seems like things are kind of taking a turn for the worse in some places. What I'm excited about is that there are so many of us that have been able to weather the storm. A lot of families who are healthy and thriving, and so we're excited. We're excited about all of that, right? But today we're going to talk about COVID-19. So if you have a question, go ahead and put it in the comment section. Put a Q in front of it, and we'll know that that's the question we need to get to. So many different things that are going on. We have recently the FDA has approved one of the vaccines as a vaccine, right? So everything else was done under the emergency use authorization. And so for the first time, we have a vaccine, or we have one of them that actually has, and we'll talk about that here in a minute. We have one of them that actually has been approved as a vaccine, right? So it falls now in the categories of other vaccines that we have and that we use all the time. So that's the Pfizer, and we'll talk about that a little later. But once again, hey Jeanette, good to see you. Good evening, everybody. Yay, God bless you as well. Okay. So let's see, where do we start? Why don't we, I'm going to go ahead and pull up one of the questions that let's see if I do this one. Let's see if I can grab this guy up here. All right, you guys see that Q right there? So if you put a Q in front of your questions, then we'll be able to, we'll know that's a question, and we'll go ahead and pull it up and be able to answer that. All right. Before we do that, I'm going to put Jeanette. Hey, Jeanette. Good to see you. Thanks for hanging out with us. Let's see. We got Francis. Doing well. Thank you. Thank you for asking. And we got Miss Ashley. Hello from Ella and I. Good to see you guys. All right. Can you give info about the booster shot? I like that. I like that. Well, let's go ahead and let's answer this question here, and we will get those as we go. So once again, if you have a question, put a Q in front of it so that we know that that's a question that we need to answer. Okay? Question that we need to answer. So here's one. Do people with diabetes have a higher chance of complications? And that's actually a very good question. And before I answer that question directly, let's talk a little bit about diabetes and put it in a little context. So diabetes is a disease that is affecting the entire body. So all parts of the body, are affected. And one of the areas that's affected is wound healing, immunity, that is how the body deals with foreign things that come into it, or infections or other toxins that may be found. And so diabetes, if you remember, diabetes slows everything down so that the body's ability to fight infection, the body's ability to do the things it normally does, is impaired. And so that's why, for instance, diabetics, if they get a cut, then that cut takes a long time or longer to heal than it normally would, right? And so everything is slowed down. The cells that fight infection also are slowed down. So it takes longer to fight an infection. And one of the things that people don't talk a lot about is that the diabetes is actually a disease that affects the vasculature. It's almost like a vasculitis, right? So that the blood vessels are affected. That's one of the reasons that we have some complications with atherosclerosis and coronary artery disease as it comes to diabetes, because the vessels are inflamed and that inflammation causes problems. So with all that said, when a diabetic is affected with anything, not even COVID, right? Anything, their course can be much more difficult than a normal person who doesn't have diabetes. Now, throw on top of that now the COVID-19 virus. And so when diabetics contract COVID-19, their chances of going on to have more complications than everyone else increases, because diabetes makes it more difficult for the body to fight those infections. And so that the answer to this question is yes, diabetics, people who live with diabetes, have a higher chance of complications should they contract COVID-19. So very good question. I like that one. Let's see. And so if you have anybody that you know that's diabetic, anyone that is having complications, drop that in the comments. Say, yeah, I do. I know somebody. You don't have to put their name in, but say, yeah, I know somebody. And so now you have a way of kind of explaining to them how and why it is that diabetics can have higher complications. All right, so let's see. Let's get rid of this one. All right. Did that make sense to everybody? I hope. If you have any questions about that or any follow-up questions, go ahead and put those in the chat. Let's go ahead and let's bump this one up. And this is from Jeanette. She said, can you give information about the booster shot? Right. So recently, the CDC came out with some newer recommendations. And in fact, they are meeting next week again to give some additional guidance, right? And so to this point, here in the United States, we've had the Johnson, we've had the Moderna, we've had the Pfizer vaccines, and the Johnson and Moderna both require 2 doses to be what we consider to be totally vaccinated. And the Pfizer and Moderna, and then the Johnson only requires 1 to be fully vaccinated. And so recently, the FDA has come out and said that they are recommending for certain populations, right, immune compromised. And if you read the document, and I may pull that up here in a minute, and we can go through that together, they are recommending that people who are immune compromised get the booster shot, as we call it. And that is, you've got to wait, I believe it's 8 months from the time that you are fully vaccinated, from the second dose, for you to get the booster. Okay? And so that, once again, they're meeting, I believe it's next week, to give some additional guidance, to look at some new things that have come out, and to give us some more information. But that's a very good question, Jeanette. Thank you for that. So that's what's going on with the booster shot. Right. So a lot of things are happening. So recently, as I mentioned at the top of this, the FDA has approved the first vaccine. Right. All the other things that we've been doing so far have been used under the emergency use authorization. Right. So those are, and we've been saying vaccine, and let's make a distinction here now. So we've been saying vaccine. The things that we have been using were not necessarily vaccines, right? But we've called them that because they were intended to do some of the same things that vaccines have done. But now we have one of them, that's the Pfizer product, has been officially authorized as a vaccine, and that was just recently done. Hey Natalie, how you doing? Good to see you. All right, so and we'll talk about the vaccine here in a minute. I know I keep saying that, but we're gonna get to it in just a second. So let's see. Let's see. How about this question? And this says, do I need to worry about DKA, or diabetic ketoacidosis? So for those of you who don't know diabetic ketoacidosis, it is one of the diabetic emergencies. And so ketoacidosis, or diabetic ketoacidosis, occurs when the body begins breaking down ketones, and it is unable to process those ketones. And let's talk a little bit about what ketones are. So as an analogy, if you're driving a car, you put gas in the car, and the car burns the gas, but out of the back through the exhaust you get smoke, right? So that is the byproduct of burning gas. So you're using the gas for energy, but the byproduct of it is that you're producing basically pollution. Let's say that. So the body, when it is not able to burn sugar, right, glucose, because that's what it normally uses for energy, when it's not able to burn glucose, it turns to burning fat. And when it begins burning fat, one of the byproducts of fat are these things called ketones. Well, in your car, you have a muffler system that takes that exhaust and it puts it out the back of the car, right? And that's why we tell people don't start your car and sit in the garage, because you have all those fumes that are coming. So now you can imagine in the body, it is burning gas, is burning these fats, but there's no way for the exhaust to go, right? And typically we breathe it out, and that's why you find sometimes when diabetics are in DKA or diabetic ketoacidosis, or they're getting into trouble, they're breathing faster, right? Because they're trying to get rid of all of that exhaust, those ketones. But when those ketones build up, then they can cause lots of problems in the body. So that's what diabetic ketoacidosis is. And so this question is, do I need to worry about DKA? And I'm assuming the question is, do I need to worry about DKA as it relates to COVID-19? Now, once again, we've got to put in context diabetes. The first thing is that the typical person who lives with diabetes that goes into DKA, these are our patients who live with type 1 diabetes. It's uncommon for a type 2 diabetic to go into DKA, right? So that's one distinction to make. And when someone becomes ill who is a diabetic, they are more likely to go into DKA, right? Because the body is not only now dealing with diabetes, but it's also dealing with the illness. And so, I tell patients with any illness, they should be very cautious. They should continue to monitor their blood sugars. They should use sick day rules. And we did a video a while back on some of the sick day rule things to do. But they should begin following sick day rules to avoid that. Making sure they're drinking lots of fluids. Making sure they're taking their insulin. Making sure if their blood sugars are elevated that they're checking for ketones in their urine, because then they can do something about it. They can begin to treat it and begin to process. All right? So very, very good question. Let's see. Natalie says... she says, is it possible that we may have to get booster shot biannually going forward? Wow, that's a forward-thinking question, Natalie. And the honest answer is that we don't know, right? We don't currently know. The CDC is recommending for certain populations that they do get the booster shot. They've not come out yet to say that everyone generally should get it. And we are not really sure going forward how protected we will be with the booster shot. Okay. So to answer the question, we don't know currently. Once again, they are meeting, I believe it's next week, and they will be giving some additional guidance, giving additional guidance for that. But very good question. I like it. All right. Let's see. How about this guy? Let's see what this one says. So this is an interesting question, and I'm gonna actually I'm gonna save this question for a little bit later. Right? So we're gonna come back to that one here in a minute. Let's see. Yeah, so an interesting question. Let's bop this one. All right. And so this was an interesting one that came up, and we dealt with this way back. And can disinfectants be ingested as a preventative measure? And the frank answer is no. Right? We don't recommend, we don't advise that this be done. So much danger is involved with that thought. Let's hide that one. And then let's see. So here's one from Monica. She says, what's the difference between ketoacidosis and the keto diet? Ketoacidosis and the keto diet. Very good question. And there's so much that we are hearing, right? People are doing different diets. And one of the diets that they are doing is the keto diet. And the keto diet says that you want to decrease the amount of carbs, because once again, the body normally burns carbs for energy. And if it can't burn carbs, then it turns to burning fat. Okay? And so the keto diet says that I am going to decrease the amount of carbs that I'm taking in and force the body into burning fat, right? Why do we want to do that? Well, it's the keto diet, right? Because people are trying to lose weight. So if I can get the body to burn the fat, then the idea is that, one, I can decrease the amount of total body fat that I have, and so I lose weight. Some people do it for the management of blood sugars, so that if the body is having to use alternate sources for energy, then that means that there's not so much sugar in the body. So what people do is they decrease the amount of carbs they take in to a very, very, very low amounts. And that basically starts to force the body into ketosis. And the way that you know you're in ketosis, there are lots of different things that people do. They may dip their urine with a urine dipstick to look for ketones. And if there are ketones, then of course you know that you are in ketosis. Now, the difference with diabetic ketoacidosis, which we talked about a little while ago, is that ketoacidosis is an extreme condition that is actually dangerous to the person, right? Because the body is now in a extremely starved state, and so lots of different things start happening. So ketones, and we didn't talk much about this, but ketones, like the exhaust that comes out the back of your car, ketones are dangerous. So ketones, when they become high, right, they can cause changes in mentation, right, the way you're thinking. They can cause the other enzymes in your body that are doing different things to not work. Like what? Well, there are enzymes that are working. There are machinery, mechanics that are working in the heart to keep the heart pumping, right? One of the signs that we get very concerned about is if I see a diabetic, just like when we see asthmatics, who is breathing very shallowly, right? Because what does that mean? Sometimes that means that diabetic has been breathing so fast, right? Because they're trying to get rid of some of that exhaust, and they're breathing so fast, right, that they are now tired and the muscles can't do it anymore. And when that person gets to that point, right, they can't sustain their airway. And so a lot of these patients end up in the ICU intubated, right, because we've got to support their breathing at that point. And so that's what ketoacidosis does. And one of the issues with the keto diet for patients who are diabetics, and particularly type 1 diabetics, is that we don't know when a person switches from just being in ketosis, right, from the keto diet to being ketoacidosis or diabetic ketoacidosis. And so there's that fine line. And so it can be a problem for patients as they try to navigate, right? So very, very good question. I like that. Let's see. Okay, here's a good one from Jeanette. Jeanette says, is diabetes hereditary? And the answer is generally yes. That's a simple answer, all right? But I wasn't going to stop there. So diabetes, both type 1 diabetes and type 2 diabetes, and then if you kind of extrapolate that to gestational diabetes, right? So diabetes, it involves a couple of things. One, it has a genetic component. That is, people are genetically predisposed. And then it requires what we call a second hit. So for type 1 patients, they have a genetic component, and they have some infection later on in their life. And so now that they've been predisposed and the infection happens, and now they become diabetic. Okay? For type 2 diabetics, people who live with type 2 diabetes, they have a genetic component, and then they have the lifestyle that that supports diabetes, the development of diabetes. And it's interesting to know that patients who live with type 2 diabetes, the genetic component or the hereditary component is higher than patients who live with type 1. Okay. And we believe some of that has to do with lifestyle, because guess what? Families tend to eat the same, they live the same, they have the same habits. And so there's that second hit that we talk about. They may be predisposed, but now we've got that second hit. And so those patients go on to develop diabetes. One of the things that we did earlier this month or last month, we did a video on gestational diabetes. And patients who have gestational diabetes are at increased risk for diabetes, and the baby is at increased risk for diabetes as well. So, there is a hereditary component to that. Thank you, Jeanette. That's a good question. I like that. Let's see. Oh, here's a good question. I'm gonna come back to that one here in a minute. Let's see, what does this one say? All right. Here's a question from Monica. Monica says, is it true that someone in DK has sweet smelling urine or breath? So ketones, right? Ketones are supposed to smell sweet. So when that person is breathing and when the ketones get into the urine, then it's supposed to have a sweet smell to it. And I'll tell you, I've taken care of a lot of diabetics, and I've been in the ICUs and I've been around them, and I can't say that I've smelled this sweet smelling ketones that people talk about. We read about it all the time. We see it in the books. And there are some people who say they have, but I have not really smelt it before. Now, I can tell what ketones, I believe I could tell what ketones smell like, right? So if I'm smelling urine, but for me, maybe I have a bad nose or something, right? So for me, I don't necessarily smell sweet. But good question there, Monica. So Natalie says, can you discuss the different types of diabetes, which is also known as sugar, right? Yeah, so a lot of times people say I have the sugar, right? So I have sugar. And so diabetes, and as I mentioned before, there are several types of diabetes. The main types that everyone know about, the two types that people know about, type 1 and type 2. Okay. And type 1 diabetes usually or previously was called childhood diabetes or juvenile onset diabetes, right? That's type 1 diabetes. And type 2 diabetes was called adult onset diabetes. We just now call them type 1 and type 2 for lots of different reasons. And then there's gestational diabetes, which we talked about before. There's diabetes related to surgery. So someone who has surgery on the pancreas for different reasons, they can develop diabetes, right? Because if remember, the beta cells are the ones that produce insulin. And so if those beta cells are damaged or you don't have enough beta cells, then diabetes is there. And so you can imagine having someone who's had surgery and, some of their beta cells or more than half of their beta cells or a lot of their beta cells, depending on the person, are gone. And so now that person develops diabetes. Okay. There's also medication-induced diabetes. So certain medications can either damage the pancreas, or these medications can push the body to such an extreme that it can no longer handle the sugars, the blood sugars, if you will, that it needs to manage. One of the most notorious ones for that is steroids, right? So a lot of people who are on high dose steroids will show up with diabetes. Now, there's a whole conversation that can go into whether the steroids cause the diabetes or whether the diabetes was there and the steroid just makes it worse. That's a whole nother conversation. There's also diabetes that develops, it's called NODAT. So new onset diabetes after transplant. So patients who have transplants, they a lot of times, well, sometimes will develop diabetes following that. And we believe that that's because there are certain changes in the body, how the body functions. And then also because they're on certain medications that can push them into diabetes. So anyway, so that's a spectrum of different types of diabetes. But going back to the first two or first three, type 1, type 2, and gestational. So type 1 diabetes is an insulinopenia, meaning that there's a decreased amount of insulin. So what happens, as I mentioned before, you got the genetic component, you've got the second hit, and because the pancreatic cells become damaged, right? They become inflamed and they actually begin dying. And when they die, the body can no longer make insulin. And because it can't make insulin, then that person becomes a diabetic, and we call that type 1 diabetes. Type 2 diabetes is a function of insulin resistance. So once again, the body is able to make insulin, and it makes more and more and more insulin to try to compensate for higher and higher blood sugars, to compensate for increase in weight. And when the body can no longer keep up with the requirement, then diabetes occurs. Not that the body can't make the insulin, but it can't keep up with the requirement. And so then insulin or diabetes happens, and that's type 2. And then gestational diabetes is a subset of insulin resistance. There are hormones that are produced by the placenta, and these hormones, they cause other changes in the body, and so the body becomes insulin resistant, and it's not able to keep up with all the things that it needs to do. So very good questions. I like that. All right. And yes, a lot of people call that sugars. They say, I have the sugars, right? So we have the sugars. Okay. All right. So let's see. Let's see if we can tackle this question. Let's see. Does the vaccine prevent COVID-19? Now, I'll tell you, up until yesterday or day before, or even today, I think I said something. I have been telling people and purporting that the vaccine, all the things that we've been using, the ULAs, the Moderna, the Pfizer, the Johnson, that they do not prevent the contraction, prevent you from getting COVID-19. Well, the FDA has now approved the Pfizer vaccine as an official vaccine. All right, so let's say that again. So up until this approval, all the other things that we've been doing, even though it is the same thing, by the way, so when you look at it, I mean, there's no difference between the two. But up until this decision, all the things that we've been using were being used under the emergency use authorization, right? And now the FDA has come out and said that there has been enough testing for the Pfizer vaccine that it can now be approved as an official vaccine, and it now stands just like the other vaccines that we've known, right? So it has the same parity. It has the same level of support. It has the same level of evaluation, is what they're saying. And I think there were 22,000 people that they had in the studies, and they've been following them. I forgot how many had gone out to 6 months. But with the approval, right, this is now a vaccine. And if you read what they're saying about it now, they're saying that the vaccine, right, can now be used to prevent COVID-19. Now that's very different from what we've been hearing and what we've been saying, that the vaccine prevents someone from getting more complicated disease compared to someone who is not vaccinated. And so now with the change, with this approval, with the change in their statement, they're saying now that the Pfizer vaccine can be used for prevention. Now, they've not commented on the other two products that we are still using under the emergency use authorization as to whether they can also be said to prevent COVID-19. The other thing is that they are saying that they will still continue to use the Pfizer vaccine under the emergency use authorization. And I think that is probably because it allows for greater distribution of the product. Okay. So once again, it's been approved. It is the only one that the FDA has approved officially, unless something's happened while we've been here on the live, right? So they've approved that. Let's see. All right. So I've got some questions coming in. She said many questions can't be posted. She said, whenever we buy food in the grocery, should we always look out for sugar? I like that. So whenever we buy food in the grocery, should we always look out for sugar? So let me take this off the screen. See, hide that overlay. Okay. So should we always look out for sugar? So I'm pausing because this is a huge question. But I love the question. I love it because it really gets at the crux of all the things that we talk about, right? It gets at the crux of all the things we talk about. So sugar was traditionally not something that we as humans consumed. Yeah, let's pause there for a second. Right, so back in ancient times, right, they didn't use sugar, right? They may have used honey, but once sugar came on the scene and sugar was taken into Europe and sugar made it into, quote unquote, the Western world, and then we were able to refine it, right? It became ubiquitous, meaning it's everywhere now. So I don't know that you could even find a product that doesn't have some sugar. I guess if you get a piece of meat, right, then there's no sugar in it. But sugar's everywhere, and we have learned, and we've been trying to get things sweeter and sweeter and sweeter and sweeter. All right. Now, I remember growing up, and we would eat cherries, or for those of you who are online, gooseberry, right, is a little berry. Is it a berry? I guess it is a berry. Gooseberry. Okay, there you go. But we would eat those things, and we would sometimes have some. I guess we made things with molasses, and then there was brown sugar, and my little guy is like a sugarholic. He loves sugar, right? So anything that's sweet, we love. And I've got to admit, me too. So when we're looking for foods, I usually tell patients to look at the carbs, right? Tell people to look at the carbs. For instance, sugar-free cookies. Yeah, think about that, right? So sugar-free cookie. Well, what does that mean, right? That means that we didn't put any sugar in it, right? And so supposedly for a diabetic, they can eat all the cookies they want because it's sugar-free. Well, guess what? If you take that cookie and you look at it, it comes from, well, what else is in that cookie? There's wheat in that cookie, or, some grain in the cookie. Well, where did the grain come from? Well, it's a carb. And so you can have a sugar-free cookie that has as much carbohydrates in it as some other things that are just full of sugar. And so sugar-free, right, does not necessarily, help us out. So I tell people to look at carbs, right? And there are lots of things that you can read, and different people tell you different carbs. I usually tell patients that they should limit their number of carbs to about 45 per meal. Now, that's 45 per meal. Typically, diabetics will tell them that. Do you know how much the average person eats per meal? Yeah, take a guess. Yeah, about 150 to 200 per meal, right? And that's the whole day's worth of carbs that they're eating in that one sitting. And so you want to be careful with that. And then the other thing is that sometimes there are these hidden sugars, right? So sugar alcohol doesn't show up as sugar. Yeah. So you want to be careful with that. Let's see what else we have. It says, should it say zero sugar so it is something that we can consume, or is there a special amount of sugar that we are allowed to take every day? And once again, I usually tell people to look at the carbohydrates, and I usually tell them 45 grams of carbs per meal, 135 carbs per day. So 45 grams of carbs per meal, 135 per day. All right. So let's see. Let's come back over here. Whenever we buy. Okay, so she did post those in here. Okay, good. All right. So if you guys do you guys know anybody who's having issues with sugar, having issue with diabetes, having issues? Drop those in the comments. Just say, yeah, I do. There are 34.2 million people in the country that have diabetes in the United States that are diabetic, right? There are 88 million who are pre-diabetic. And the last time I looked at the World Health Organization at their website, and I'll pull it up here, there are 400 million to 600 million people in the world, right, that are diabetic, living with diabetes, pre-diabetics. I mean, it's huge. And we are using the phrase pandemic to talk about COVID-19, right? So the COVID-19 pandemic. And so pandemic means everywhere, right? If we're going to get a handle on diabetes, we've got to start using the same types of words with diabetes, because it's huge. I mean, it is tremendous. It's everywhere. And if we are going to get a handle on it, we've got to do something drastic. Okay. Let's see. What do we say here? I'm trying to grab some more questions. Okay, here's one. Let's see. It says, what are the factors that healthcare providers caring for COVID-19 patient can consider before allowing patients to self-test using a home-use blood glucose meter? Let's see if I can decipher that a little bit more. So it says, what are the factors that healthcare providers caring for a COVID-19 patient can consider before allowing patients to self-test using a home-use blood glucose meter? I'm not quite sure what the question is asking, but let me take a stab at it. So glucose monitors are a wonderful tool that we have access to, and the reason that we have the reason it's a wonderful tool is because it gives us data, right? Now let me say that there is no magic in checking your blood sugar at home. There is no like checking your blood sugar itself doesn't solve a problem, right? It doesn't fix the blood sugar. But checking a blood sugar allows you to know what the blood sugar is. And if you know what it is, then you can treat it, right? You can make a decision on what to do to treat that blood sugar. And so that's what glucose monitors allow us to do. Now, back in time, in history, we didn't have glucose monitors, right? Patients who are diabetics will tell you in the early days, they used to take their urine and dip a stick in it, and then they would look at the stick, and they would, from the base of the stick, to tell how much sugar is in it based on the change of the color, or taking the tablets and dropping it in the urine, right, and seeing it change color, and then you could tell on average what you thought the blood sugars were. And so we've come a long way from there, and being able to now monitor blood sugars at home. And then, when continuous glucose monitors came out that allow you to monitor blood sugars 24 hours a day, that has been a tremendous help in the management of diabetes. And so I don't know that there's any consideration that we need to take before allowing people to monitor their blood sugars at home. I think if it's needed, it's needed. And so having a glucose monitor and checking those blood sugars for our diabetics is so huge and so very important for us to do. Okay. Let's see. Let's say my friend. Let's grab this one here. So Jeanette says that my friend has diabetes and lost her eyesight. What caused that? Whoa, you guys have some great questions. I love this. Okay, so diabetes. Let me find a different analogy. Okay, so cars, and you guys may or may not know about cars, but I'm gonna use a car example. So I remember we lived up in Ohio, very cold, by the way. I'm so excited that I'm in a warmer weather, but we lived in Ohio. We were there for about 4 years, and love the people up there. Hopefully some of them are watching us right now. But I remember coming out and turning the car, right, and the car didn't start because it was cold, and so you'd sit there and you'd pump the gas, and you go, right, and the car would start up. Well, what happened if I pumped the gas one too many times? Well, it would flood the carburetor. And so the car wouldn't move at that point. It wouldn't drive at that point. And so even though there was energy in the car, even though there was gas in the car would not move because we had flooded the carburetor. And so you would then have to wait for the gas to dry before you could do anything with the car. And so the body is that way, right? So remember, the body uses the food, carbs, for instance, get turned into sugar, glucose, and the glucose is running around your body just like gas. But because there's so much, it floods the system, right? And that gas, if you will, the glucose gets into everything. And we talk a lot about the eyes and the kidneys and the feet, right? And that's the triopathy, retinopathy, nephropathy, and neuropathy. But the actual fact is that every cell in the body is being affected by the same elevated blood sugars. Okay, and so for the eyes, one of the reasons that is important is because the sugars, the blood sugars, being high. Remember, we talked about it affecting vessels, right? Vessels, blood vessels, and the heart, and the legs, and the kidneys. So it also affects vessels in the eyes. And so retinopathy is where there is bleeding in the back of the eye, right? And so because there's bleeding in the back of the eye, there can be damage, and that can cause vision loss. So that's one of the ways that diabetes causes complications, right? All right. Let's see. So that's a good question. Thank you, Jeanette, for that one. And let's see. Let's grab a couple more. Let's get rid of that one. And here's one from Monica. She said, why is diabetes not considered a pandemic since it seems to be so widespread? Wow. Ooh, you guys are good. And actually, Monica, this is another one that I don't have a ready answer for, right? We continue to we continue to work and to strive to control diabetes, but there are some precursors to diabetes that we can manage to prevent people from progressing. Remember I told you that there are 88 million people in the United States alone that are pre-diabetic. So these are people whose blood sugars are higher than normal, but not high enough to be considered diabetic, right? So let's forget about the diabetics for a minute. Let's forget about them, right? Let's go back to these 88 million people. Well, so these are typically type 2 diabetics, right? People who live or they're going on to become type 2 diabetics, right? So what do we think is the big issue with a lot of these people? Well, a lot of it has to do with weight. A lot of it has to do with other choices that we're making. A lot has to do, and once again, it's not always the blood sugar that's causing the problem. It's not always food that's causing the problem. Stress causes weight gain, okay? And so maybe you have someone, maybe they're not eating, right? They're not eating their way to diabetes, but they're stressed, and so their weight goes up. And so the body becomes stressed, the blood sugars are a little higher, and they get higher and higher, and they're not getting enough sleep. And so, right, so all these things are setting them up for metabolic syndrome, that is high blood pressure, high cholesterol, increased weight, big BMI, right? Or it's not big BMI, but elevated BMI. And so that patient now is a prime candidate for progression to diabetes. Right. So there are so many things on this side of diabetes that we can do that prevents us getting to diabetes. And the answer is, I'm not sure why I'm not sure why we don't use that word yet for this process. But if we're going to get a handle on it, we have got to, and there are a lot of organizations, a lot of people out there that are talking about it, right? But all the things that we have been doing, all the things that we've been teaching, it's not working, right? Because we've been saying this for years and years and years and years. What do we say? Eat less, move more. Eat less, move more. And we're finding that is not the answer. It's not as simple as that, right? There are so many other components to it, and until we begin addressing all of that, then it becomes a problem. And I mean, just a simple thing, right? And all of us, I say all of us, but a lot of us would say, hey, that guy, that gal, this is something that they did to themselves, right? So they are the one who progressed to this. Well, there are so many socioeconomic issues that come into play that it's not as simple as if he wanted to, he could fix this, right? And so we've got education, we've got to have support, we've got to have processes, we've got to have plans that can address all of that. Thank you, good question. All right, and let's see. So Yolanda said, yeah, I definitely do, and I think this is in response to do you know anyone who has diabetes? Yeah, and we all, I think I would say that everyone that may be on right now probably has someone that they know who is diabetic. And then let's do this one. So Monica says, why on my CGM is my blood sugar one number but different with a finger stick? Oh, Monica, I love your questions. All right. So what she's talking about is a lot of times, and I mean, stepping away from CGMs for a minute and just in general. So if I get a glucose monitor and I prick my finger, all right? And I prick my finger and I get one blood sugar, it is possible to get another meter and use the same drop of blood that's on the finger and check the blood sugar and get a different number. In fact, to go even one step further, it is possible to prick my finger, use a meter, get a number, keep that same drop of blood, put another strip in the same meter, and check my blood sugar again and get a different meter, different number. Okay, because the meters, all right, here's I'm gonna give away one of the secrets. the industry secrets, the meters are not exact. Oh, wow. I'm going to have somebody coming after me now, right? So the meters are not exact, right? There's not an absolute number that they give you. So when you check the blood sugars, they're allowed to be within a variance different from each other. And so that's the first thing. The other thing is, if I prick my finger, right, that blood is coming directly into those capillaries. But if I put a continuous glucose monitor in, which goes into the interstitial tissue, then when blood is flowing through the capillaries, it has to seep into the tissues, and then the continuous monitor has to pick it up. And so when that happens, right, there is a delay between what shows up at my finger and what shows up in my interstitium, and so you can get two different numbers for the CGM compared to the finger stick. Very good. All right, and then we're gonna do one more question. Let's see, Jeanette Walters. She says, here you go. Say, can diabetes be reversed if I change eating habits? Woohoo! Jeanette, you just want us to go out on a bang. I love it. I love this question, right? So if you look around, you'll see a lot of places that talk about reversing diabetes. And I used to resist the phrase reversing diabetes. And it's starting to grow on me, right? So reversing diabetes, what does that mean in general? Let me give a quick example or quick explanation. Because we say that type 2 diabetes, people who live with type 2 diabetes, it is a huge lifestyle component, whether it's weight, food eating, lack of exercise, metabolic syndrome, and all the things that go on with that, right? The idea is that if I can step back on those things, if I can reverse those things, if I can now start eating better, lose weight, exercise, then I can reverse the diabetes. Okay? And the fact is that is for the most part true. That if we begin adjusting those lifestyle things as people talk about, then we can have diabetes that then is reversed, and so the blood sugars are better. Now, here's the kicker, right? So let's assume that you reverse diabetes, right? So you've gone back on all the things that got us to this point, and blood sugars are great, life is going great. What do you think happens if you start doing some of the things that you were doing before? That's right. Right, the diabetes came back, right? So this idea of reversing diabetes, right, is a little bit tricky for people, right? Because sometimes people think I reversed it and it's gone and I can just do whatever I want. And the answer there is not true. Now, and that's just a general description of it. But very good questions. All right, guys, thank you all for coming. This has been exciting. I love this. We are, as I told you in our live podcast last week, we are so excited to be doing this. We're going to be doing a lot more of this, because keep an eye out, keep an ear out for our announcements for when these are going to be. We're trying to find a day. So if you have a day that you would like us to do this, just drop us a message at our email, drdwainwoode@gmail.com. You'll see all of our, let's see, where is it? Over here. All of our social media things there. You'll see TikTok. The last one I was doing a little something. So Maria is our social media person, and so she had me singing and doing sugar ho ho ho. So go ahead and look at that one. There's link. Ooh, I can't get to it. Right there. There's LinkedIn. Of course, there is our YouTube page. There's Twitter, and then Buy Me a Coffee. Also, all those things you can reach us. But please subscribe if you've not already done so. Go ahead and hit our like button, share it, talk to your friends, let them know that we are doing this. We're so excited. Thank you all for being here, and let's get some music to get out of here. Here we go. guys. Have a great evening.